And then
share my screen.
You're sharing your screen already. You can just advance through the slide. And everyone can hear us.
Good morning. This morning, we're going to be talking about some updates for Two Rivers Public Health Department. And the month is mental health awareness. And so we're going to be touching on that and bringing that into our talk.
You got to talk louder, I think.
Where do I talk into?
Talk your camera. Yep.
Here?
Talk at your camera. Yep.
Okay, well, I guess I wasn't talking loud enough, so I'll just go ahead and repeat that we are going to give some updates today for Two Rivers Health Department, and we're going to be emphasizing Mental Health Awareness Month. So where we are is Two Rivers, and we're, the 7 counties for the Two Rivers Department is Buffalo, Dawson, Phelps, Kearney, Harlan, and Franklin and Gosper counties. And this is what we do. Two Rivers does the disease surveillance, chronic disease prevention, emergency response, and collaborative lead exposure. So we're a very busy group here. Our mission is to engage in collaborative partners, community leaders, and the public to promote healthy lifestyles. And that's exactly what we're going to be promoting today. And our vision is, of course, that the health district where we are all able to safely and actively live, learn, work, play, and be in our community. Here's Region 7. It includes Nebraska, Iowa, Kansas, and Missouri. And here are the COVID updated numbers. Our total US cases are 81,492,000 and 170 million people. So we've got a lot of confirmed cases here and almost 1 million deaths at this point. Okay. So I'm going to speak louder so that you can hear me better. But anyway, here's the total numbers for Nebraska. Our total confirmed cases are 480,805 and 4,216 deaths. So you can see that it's taken a toll in our state. Here's the updated numbers for the Two Rivers Health Department. Our 7-day averages of our COVID cases for this year and last year. So you can see everything is trending down. However, the district daily case rate for 100,000 people has gone up just a little bit since our last talk. We last reported in April, and so this is a month's difference. So it nearly doubled since then. So it's just kind of an indicator to show us, you know, what our trends are. Okay, here we have our Two Rivers Public Health Department hospital data, and you can see here the IC beds available percentage, and you can see here how our numbers are trending here for the ICU component, the availability, and the ICU staffed. And you can see the percent of COVID beds. The numbers are going down each month. The surgical beds available, you can see here, it's kind of a steady number. And then the COVID hospitalized patients on vents, you can see here that the ventilators, the hospitalized numbers are higher and the need for the ventilators is not as great. You can see here on the Two Rivers, the updated numbers for patients in our district. You can see here that we've got 205 total med-surg beds, and we've got 83 beds that are available, 32 ICU beds, and 11 ICU beds that are available. And currently there are no COVID patients. So there's 2 inpatients that are positive. So you can see here that the numbers are really trending down, and recovery is on its way. So you can see here that May is Mental Health Awareness Month. And so you've been through a lot. We've all trudged through this together, and we're kind of on the downside of it. So now what? When you have time to think about, what you've just been through, you might have a little post-traumatic stress from everything that you've experienced in these last couple of years. So mental health is an incredibly important part of our overall health. You can't be physically well if you're not mentally well. We have a growing number of Americans experiencing mental health symptoms, and we need to join together to advocate for improving our nation's mental health care system. So you can see here that there's a lot of work to do, and maybe we're through the worst of it, but now we've got that mental health component to deal with. We've got some self-care suggestions, and these resource links are really very good. These are all linked so that you can get this information. This How Right Now campaign is just excellent. It goes into, it gives you a grid and it just says, how are you feeling? And it gives you several different options as far as anxiety or worry or, just kind of the different emotions that you might be feeling. And so you click on those and it tells you what you may do. The next one, a guide to promoting healthcare workforce well-being during and after COVID. The COVID-19 is specifically for pandemic response as far as our mental well-being goes. And if you click on this link, it's just really just a wealth of resources as far as, what you can do, some daily suggestions. It's just a very well-directed link that will be very helpful. And then the last one, the rising stress and burnout in public health, is also very good. It kind of turns it around. It says on the employer's part of it, what can we do to help you? And if I remember right, in this particular link, it talks about survey results. And when they surveyed the employees, 51% answered, we need more help. And so, it's just kind of working together to see, the employer saying, what can we do? And the employee has a chance to say, well, this is what we need that can make this be better and get us through this. So please go in and take a look at these. They're very good. And I think they're very helpful. When you're in an airplane, they give you a little speech in the airplane about how you're going to have a safe trip in the plane. And they're going to say, the oxygen mask is going to drop from the ceiling and you're going to put that on first, and then you're going to go help others. You don't go around putting that oxygen mask on everybody else. You take care of yourself first. And that's a good example of what we need to do now as far as the pandemic goes. We've weathered the storm, but we need to be well so we can help those who are not coping well with the process. This is kind of late notice, but there's a really good webinar today that I really wanted to make sure and promote for you. It's put out by Region 7, and it's our response system that is putting this on. But today there's a webinar from 12 to 1 that talks about this very thing about responding to the COVID crisis. It's the psychological response that we have. And so it's just helps us to know how to deal with this. It's for medical professionals. And so I think it's a very good option as far as being able to help others. It's like that psychological first aid. You may be the first one that they talk to and say, I'm just not handling this well. And it gives you the steps to go through to tell you what would be most helpful to help someone else. Okay, we did include the update on the flu view, and it's these are the updated numbers you can see here. We're in the green area, so that's looking fairly good. It's fairly stable, I would say. So influenza is something that's going to be around and it's going to stay around, and so we just try to give an update and let you know the numbers so you can kind of see where the more concentrated areas are. Nebraska is looking pretty good, kind of here in the middle. Okay, this next slide is all on the lead exposure. And we just wanted to make sure and get this information out to you. It's talking about the new guidelines as far as the lead levels that are acceptable, and the level that says you need to do something about this. So 3.5 micrograms per deciliter is the new number that they changed to in January of 2022. And so it used to be 5, and now they changed it to 3.5. And so that's really important to use that as your guidelines so that you know that that's what you need to get to base your blood draws and your repeat blood draws. If you can see the links that are provided here, it gives you all of the additional information on the lead exposure. And then it also has some really good graphs here that are very useful in telling you that initial capillary blood draw is going to be the grid on the left, and it's just going to give you the recommendations. Under 3.5, you just need to confirm that with a venous blood test. But at that point, there's no confirmations needed. Repeat testing is according to the blood lead screening plan. If it's over that, from 3.5 to 9, then you need to recheck that within 3 months. And again, that's with a venous blood draw. So you can kind of see your numbers here as they go up, and that tells you, your time period as far as your testing goes. And then on the right, it just gives you like when you have that initial venous draw, then it just tells you when your retest schedules are. So if it's 3.5 to 9, then you retest in 3 months. Retest schedule after the blood levels are declining is 6 to 9 months. So hopefully this will be a really good guide for you, and you'll be able to post this someplace where you'll be able to make sure that you have these recommendations available. And like I said, the links are all here, so you can use that for your references. The next thing that we wanted to share with you this morning is the Nebraska Tobacco Quit Line has a really good opportunity for continuing education. It's for smoking cessation, and it's just like a program that is going to give some free CEUs for credits, and they're broken up into several different programs, and the CEUs are like 0.5 or 0.25 or some that are 1.0, but there's several different modules that you can watch and get free CE credits. And so we thought that would be really good to, being this is a renewal year, to make sure and get those credits that are available to you. The next thing that we're going to talk about is the COVID data tracker. It's a weekly review, and this was also very good. It's got a very good tool on here. It's called what's the COVID-19 community level. And there's so much information on COVID. It's so hard to keep track of where things are, but this is just a simple tool that tells you whether your county is low, medium, or high. So it just is, just gives you some guidance and just a quick look to see where we're at. So I've also included the links are available here so that you can go in and click on those. And then the cdc.gov coronavirus also has the rest of the information from this weekly review. There's a lot of information on this particular site. There's a link here, I think it's on the next page, where it just talks about making sure that you have the most current information. Like I said, this one is specifically on the counties, but there's a newsletter that has a lot of good weekly review information for COVID, easy to read. Okay, the next part is talking about it's really a significant change as far as COVID goes. We've had a lot of the COVID testing, the positive results have been required, but there has been a change where the negative tests, again, the antibody testing is still required, but on the other testing, the negative results are now optional. So that's a big deal as far as what we've been doing as far as our workload goes. And so just for your reference, the link is on the bottom here. So you can go on and look at all of the information about this particular update. This was as of 4/28/22. So it's pretty important that we make sure and communicate this to all of the staff involved in this particular as far as updates go, as far as the COVID testing, we continue to do COVID testing here at Two Rivers, Mondays and Wednesdays from 9:30 to 10:30. And the people that do want to get tested do have to register at the Two Rivers website. So if you have anybody that you need to refer this information to, just refer them to the website so that they can get signed up for their testing. The next part that we're going to talk about is on the road again. And what that's talking about is our COVID clinics. We have the Two Rivers team goes out to several different locations. And you can see here on the right, today we're going to be out at the Buffalo County Fairgrounds for vaccines. And then tomorrow in Cozad on the 11th. And then Thursday, the Two Rivers office here again will have the vaccine clinic, and you'll be able to get COVID shots here as well. And then on Monday, Two Rivers again, and Wednesday, be at Holdridge, Thursday at Two Rivers. And then on the 26th, the Pony Express ride will be in Gothenburg in the morning and then in Kearney in the afternoon. So lots of opportunities to get your COVID boosters. We've got the Pfizer, Moderna, both available, and the Johnson & Johnson. So we've got a lot of options for people, a lot of availability on vaccine clinics, and a lot of vaccines that are just whatever you need, you'll be able to get at the site. So it's kind of a one-stop shop for you. So again, like we were saying, it's Mental Health Awareness Month. So I've given you lots of information, lots of updates, lots of changes in our COVID world. And so you can see here, we started out with some rocks and they were balanced. And so we need to continue to do that balance in our own lives. We need to find something that we can do that is positive. You can see here, we have some rocks here, but I added a little flower to it. And that's just telling us that you can add one thing to your day that's positive, one thing that's going to make you feel good and make you feel like you're taking care of yourself. So we're going to do a little exercise here. And one thing that we have nowadays that we didn't used to have back in the old days was all the apps that you can put on your phone. Now you have all kinds of helps with apps that you can put on and programs that you can just add at your fingertips. And so the one we're going to use this morning is the app. It's just called Calm. And it's got several different programs in it. It's got guided meditation. It's got, you know, like your soundscapes. It's got different programs. It's got little programs in for kids sleep. So it's a really good app to have on your phone. It does cost a little bit. So, I mean, you have to consider that, but it gives you some very helpful tips as far as, you know, being able to manage stress in your life. So I just want you to, I know you'll say you don't have time to think about something for yourself because you are in healthcare and you take care of everybody else. But again, you have to put your own mask on first. So we are going to have a little time here. We're going to use the Calm app. And we're just going to give you a little time. We're going to give you a minute and we're just going to sit and we're going to think about this. And we are going to spend some time. You have a minute and just to close your eyes. And it's just a breathing app. And I just want you to close your eyes and think about something positive that you can do every day that can make you feel good about yourself. So we're going to go ahead and start that right now. Okay, here we go. Okay, did you think about something that you could be doing for yourselves? I hope so. So that concludes what we're going to talk about today. And so I just want to know if anybody has any questions on anything.
I don't actually see any questions.
Okay, if you don't have any questions, I guess we'll call it a day. You'll get some time back. Thank you. Okay, and
I would stop sharing and end meeting for all.
right down here and
yeah, where you would, yep, the red.